Hi guys, welcome to my channel. Today we're going to be talking about diarrhea and vomiting. So I'm a GP and I get to see quite a number of people on a daily basis when I'm working, and most of the concerns that they have is usually around diarrhea and vomiting. A lot of people would get a bug and would just struggle on how to just the normal first aid advice that they would need to recover before they get in touch with their doctor. So I thought it would be a good idea to just put it out here how I normally advise my patients, and hopefully you can learn a thing or two. We're going to be jumping right in. So here I have Dioralyte, a glass water, a measuring cup, and some spoons. So any advice I give here is for informational purposes and it should not replace your doctor's advice. So whichever part of the world you're in, please contact your GP, your doctor, your clinician to get appropriate advice for yourself. So diarrhea is just when you're passing very loose stool, more than once or twice, 3, 4 times, however many times a day, just more than your usual. And vomiting is when you're bringing up your stomach content. And a lot of people would get this illness because they caught a bug, or they might have underlying disease. And like I said, that's why everything is not gastroenteritis, it's not a bug. But if you do get diarrhea and vomiting, contact your doctor. But before your doctor gets back to you, the best thing and the first thing that you can do is to start to rehydrate yourself. In the UK, what we normally use is Dioralyte. This is the brand that we use, but I think in the world it's just generally the oral rehydration salt. I like this this flavor because it's quite nice. My kids like it. It's the black currant one, so it's just 1 sachet. And it's very easy. The goal is to so usually when you're having diarrhea and you're having vomiting, you actually lose the salt in your body, and obviously you're losing water as well. And for most people, the more they are sick, the less water they want to drink. Or what I hear very often is, I can't keep anything down. Usually that's a fact, but it's usually the way you do it and how you do it. So my goal today is to show you exactly how to do it so that you can keep fluids down, replenish your energy, and all of the salts that you're losing will be regained as well. So 1 sachet of Dioralyte, you just open it, check the expiry date, stick it in. So you need to wash your hands first before you do this. Obviously it's a very contagious disease. So 1 sachet in there, and I usually use my measuring cup. So it's 200 ml of water, stick that in. 200 ml of water, 200 ml. You can use anything that would measure for you. So I like to do this so that it actually mixes the Dioralyte very well for me. So once I've done that, what I do for adults, or what I say to adults is take a tablespoon. So I used to tell them use a syringe, but most people don't have a syringe, and even if they do, it's like old syringe and it's still not really clean and hygienic. So wash your hands, mix your Dioralyte. If you're an adult, 1 tablespoon. You mix and you set a stopwatch, or you look at the clock, whatever you have. I usually tell people to get an A4 paper, but if you don't want to do that, that's absolutely fine. Just take 1 spoon. I'll just drink it. 1 spoon every 5 minutes. Actually, it tastes really nice. 1 spoon every 5 minutes. So if I start at 12 midday, my next dose will be at 12:05. Yeah. If I took the next one at 12:05, my next dose is at 12:10, 12:15, 12:20. You just keep going every 5 minutes. What most people do is that they would start to take sips. Usually the body is already all over the place with the bug, and would struggle to manage that level of volume. For children, depending on their age, I usually would advise the small teaspoon. So just 1 teaspoon again for children. So adult children. So every 5 minutes, and you start doing this. You've got your doctor, you're waiting for your advice. You just keep rehydrating yourself, and you see that the time of illness is usually less. You have less vomiting, and people recover quite quickly. So like I said, this is all for informational purposes. If you have any questions, or if you find this video helpful, please share, comment, subscribe, and hit the notification bell so that you can get more videos when I upload new ones. Thank you very much for listening, and yeah, see you in my next video. Bye.